Hi, I'm Dr. Scott Haydon with Austin Plastic Surgery Institute, and today we're going to talk a little bit about breast augmentation. This is the most commonly performed procedure by plastic surgeons in the world, and it's something that we do a lot of here. So we're going to talk about the whole gamut from the procedure itself to the implants, recovery, etc., and hopefully we can answer those questions that you have. A lot of times people want to know, well, who's a candidate for breast augmentation? It's basically anybody that wants to have larger breasts. The majority of the time we use implants. There's some people that are candidates for fat grafting, but you can't really make the breast that much bigger with fat, and so oftentimes it's not a really good choice. One of the things that is very confusing to people is how do you determine what size implant? And that's probably the biggest question that we get. The first thing that we do when we do your exam is we do a bunch of different measurements, and probably of those measurements, the most important one is the base diameter. And the base diameter is basically how wide the breast is. So in other words, it's the platform where the implant has to sit. I tell people that implants are kind of like shoes. If you wear a size 6, you can't wear a size 5, you can't wear a size 7, but you can kind of cheat half sizes. And so with implants, we know that we can go, a few millimeters or even a centimeter away from that base diameter, and that gives us an idea of the range of implants that are going to fit. I also think, it's kind of an analogy where, there's a certain seat and there's a certain size butt. And if your butt's too big, it can't fit in the seat. And so when we're trying to find an implant, if I choose an implant that's too narrow, I'm going to give you a very narrow, pointed shaped breast. It's not going to look very pretty. If I get an implant that's just simply too wide, then it either is going to try to cross the other side, and then you'll get uniboob, or you get tons of fullness in the outside, kind of that side boob, or it sits very high. So we want to make sure we choose an implant that kind of fits your profile. And so we have different types of implants in different sizes. We also have different profiles. Profile means the distance that it sticks out from back to front, and that basically is kind of how round an implant is also. So when we're determining this, we start with the base diameter, and then based on what the patient wants to look like, we kind of can choose the appropriate profile so that we give them ultimately kind of the shape that we want. One of the things that we do in an effort to try and provide a simulation for someone as to what it's going to look like with different sizes as well as with clothes on and off is we use the Vectra 3D imaging, and I'm going to show you that in a minute. So this is what the breast looks like from the side. Obviously you've got the skin on the outside, and then the breast is comprised of both fat as well as gland. And all of that sits above the muscle. So that's your pec muscle. So when we're looking at someone, we're evaluating how much breast tissue that they have and then trying to determine where the best place and pocket for the implant would be. As you get older, the breast basically changes, and that's because as women get older, they don't need the ability to breastfeed, and so the gland actually gets replaced by fat, and so you have more fat and you have less gland over time. And so for someone that has had implants in the past, they may not have really fluctuated much in their weight, but 20 years later, they just feel like their breasts are bigger. And that's typically, again, because now they have more fat and less gland in the breast. All right, so now we're going to talk a little bit about where we put implants. That means, do we put them in front of the muscle or do we put them behind the muscle? And it basically is kind of dependent upon the patient, the anatomy, the size they want to be. We do not ever put an implant directly underneath the breast gland without either having the fascia over it or the muscle itself. So the subglandular placement is never used anymore because we know that the risk of contracture is just simply too high. So this is a good example of what the implant looks like when it's underneath the muscle. So again, here's where the muscle is. And now you've got the implant here, and then the body knows that the implant is not part of you. So it's going to form a specialized scar tissue that surrounds that implant. And we call that the capsule. So the capsule is kind of like the rind of a fruit. It's designed to protect everything that's on the inside. So some fruits, like a tangerine, it's very thin. Grapefruit, it's very thick. But basically what we want is a very thin capsule. So when that implant is placed, if that capsule were to become abnormally thick or firm, you can develop what is called a contracture. So if you've ever known someone that had implants and they got hard and firm and they had to have them replaced, they had developed a contracture. So in old implants, that risk is anywhere from 30 to 50%. But in our newer implants, less than 5%, and actually trending even lower and closer to 1%. So when we put the implant in, we either put it all the way behind the muscle or we put it in what's called the subfascial space, which is just under this covering of the muscle. It is a little bit different in certain patients, but if we put it in subfascial space, we also have to put in an absorbable mesh to keep it from bottoming out. So this is a good example of a patient that came in young, healthy, had not had children, and basically, she came in and said she wanted to be a full C. It's very difficult to know exactly what implant that's going to be. We never can promise cup sizes, and that's because from store to store, the bras are just made differently. The other thing is women like their bras to fit differently. Some like a tighter band, some like a looser band, and so in one bra you might wear, a 32D, and another one you might wear a 34C. So we kind of have to be careful about not getting too hung up on what cup size it will be. So with the Vectra 3D imaging, what we can do is we can shoot a picture, and there's about 6 different cameras, and it will then provide us a 3D simulation of what that anticipated look will be with different implant sizes. So in her case, this is kind of what she wanted. She wanted sort of a more full appearance, did not want to be overly round, still wanted it to be fairly natural and have it, fit her frame. And the nice thing too is we can show it both with and without clothes. So in a lot of our patients, one of their biggest concerns is it going to make me look too big? Am I going to be too unnatural? And if I show them, what it looks like with the top on, then it kind of gives them sort of that peace of mind of, okay, this is what it, is going to look like. And so again, I can show implants that I feel like probably aren't big enough. Then I can show implants that I think are going to be kind of too big, and then I make sure that I'm on the same page with that patient. Another thing that can be helpful is if patients want to bring in pictures and kind of inspiration type things of what they are trying to achieve. And so again, we can look at those sometimes and make sure that we're on the same page with the patient and make sure that the implants that we're choosing are going to fit that frame and then look like either the pictures they brought in and hopefully to the Vectra imaging that we talked about before. So day of surgery, how does all this work? When you come in, the surgery center is located next to our office. You will have an IV placed and you'll have medicine given through that. The surgery is done under general anesthesia. It takes, about 40 minutes or so, certainly less than an hour. Inside, I do put a medicine called Exparel. Exparel is a long-acting local anesthetic, and what that does is it cuts down on pain. And so for the first 2 or 3 days, when that swelling is kind of starting to peak, you'll have less of the pain and the discomfort. And the hope is that you really don't need any narcotic, only because we just try to avoid it so people don't have problems with constipation and nausea and sleep disturbances and things like that. We do have other medications, in some cases like muscle relaxant, things that can control nerve pain that we give, but we want a very rapid recovery. We really talk about having a kind of a 24-hour recovery. 24-hour means that, you're just kind of putting ice on and off the area, not doing a whole lot. Once the surgery is finished, I have already put in the sutures that dissolve, so nothing ever has to be removed. There's a protective skin glue that's placed as well, and then kind of a clear plastic dressing. When you come back at week 1, our nurse takes that off, make sure the incision site looks good. So that makes it very nice for the patient. There's no drains that need to be used. So again, these are all things that are helpful so that the patient has the least amount of things that they have to do post-op. We tell them to put ice on and off the area. They're able to take Advil or Aleve, and most of the time that controls the pain that they have. So after the surgery, you will come back kind of the first week, as I said, to see our nurse. As long as everything is going okay, I see you back a week or 2 after that. At that point, it's been probably 2 or 3 weeks, and I'm probably letting you do most of the things that you want to do. In other words, we do limit you in that first couple of weeks, saying, okay, no heavy lifting, no pushing, pulling heavy stuff. 10 pounds is kind of your limit at the beginning, and that's to allow the implant to not move around in its pocket, and we just put you in kind of a soft bra that doesn't have an underwire. But again, at the 2 and 3 week mark, you're probably getting back to all of your activity. That means running, that means lifting, that means Pilates, yoga, etc. You probably will have to start slowly and then kind of ramp up, but there isn't any reason that you shouldn't be able to do all of those things going forward. After about the 3-month mark, then we really don't see you back until you're closer to a year out. Certainly if you have any issues or concerns, we always see you sooner if So let's talk a little bit about what are potential complications. Anytime we do surgery, there's a risk of bleeding, there's a risk of infection. Those risks are less than 2% in this type of surgery. Our worst case scenario is you have an infection with the implant and it has to come out. It has to come out and it has to stay out for 6 months, and then we can hopefully put it back in. That is extremely rare, less than 1% of the time. We talked about the long-term risk of capsular contracture, which is that hardness or thickness of the implant capsule against the implant. We do not use the old textured implants anymore. There's a very rare form of lymphoma associated with these, so we only use the smooth and the round implant. There is an entity that people have discussed for those that have implants, and they say, well, now I've got brain fog and myalgias and these weird feelings, and they will call it breast implant illness. We've never been able to correlate those signs and symptoms with the implant itself. So I'm supposed to tell you about it, but fortunately we really just don't have a problem with it. Anyway, so my hope is that we've provided you with information that is going to be helpful to you in your journey on breast augmentation. It's a wonderful procedure. It really allows women to wear things that they're no longer comfortable wearing or that they've never been able to wear. Certainly not only in clothes, but even obviously out of clothes. We want it to look very natural, a very pretty shape, but most importantly, we want to make sure that we manage your expectations and give you the look that you want. So hopefully we will see you soon here at Austin Plastic Surgery Institute and get you ready for your breast augmentation.